Didn't think I thought Leo was before me. I thought it was safe.
His dad actually knew what he was doing. So his dad had it all set, like by the time he got back.
See you tonight, baby.
Yeah.
All right, everybody, let's settle in. We do have coffee coming at 2:45. Can you last another hour and 20 minutes? All right, just checking. If you can, I will get it for you now.
Hey, 305.
Yay! Weekend dings. Any other weekend dings in the room?
Right here.
What you got?
One for method.
One from Methodist. Anybody else? Dinging?
Get patients trying to make that money. I mean, serve those patients.
Come on in. Let's settle down, ladies in the back of the room. Take a seat. Trying to keep us on some schedule. You're voting. You'll have a break. You'll have a break in a little bit. All enjoy lunch? Don't go to sleep. Gotta stay awake.
That's what the chocolate's for.
That's right. Eat your chocolate, and then we'll get you coffee. All right. Next on our agenda, we have Leo Orozco. Is everyone listening? Shut the door. Whoever the last one in. Thank you, John. Last one in shuts the door. Just like home. Okay. So next on our agenda, we have Leo Orozco. He's going to speak about why compliance matters in home care sales. Leo has been with Total Home Health for 6 years. He's worked on a lot of different levels. Leo's worked as Chief Compliance Officer. Leo has worked as an Executive Director, actually running the Miami-Dade office, which Isabel has now just taken full responsibility for. Leo is currently our Chief Operating Officer, and we are so happy to have him in that role for our organization. Leo worked he owned his own home care company for 10 years. And he's been in home care for 22 years, but he owned his own company for 10 years. For those of you that may not know that, he was both the CEO as well as operator of the organization. Leo immigrated to the United States from Nicaragua. That was 34 years ago. And not unlike Zeus, he and his family immigrated from a communist regime. His family owned bakeries because they weren't working for the government and, I guess probably paying the government. His family's business had been burned down. They had how many trucks, Leo? 8 delivery trucks in the bakery business. The trucks were burned. And so after this occurred repeatedly, the family chose to leave Nicaragua and come to America. So for those of us who are foreign Americans, we need to listen to some of the stories around us. It's still the greatest country on earth. Yeah.
Thank you, Ms. Sharon, for such a great introduction. And let's see, everybody's awake. Thank God. We're talking about compliance. All right, yeah. And they only gave me 15 minutes. I don't know why.
You got more time. Take it.
All right, we're going to be discussing an review with regards to compliance. Let's see if we can handle this. What we're going to be discussing is the home health risk that impacts. Oh, sorry.
He's back there.
We're You messed it up. Don't give it. Wrong presentation.
We are experts, but not in the field of IT.
Somehow, right? Oh. No, the previous one. Great. Okay.
You want me to show you? Because I've already messed up.
That's not too difficult. See, it's not me, somebody's playing tricks on the page. Everything is moving on its own.
Julian, we think that the presentation may be possessed.
I think so.
That wasn't the end of the presentation.
15 minutes up.
I believe so.
Let me have it. Okay.
Thank you so much.
Life is good now.
I appreciate that. All right. We're going to be discussing the home health.
Let's talk really fast.
And you were blaming me. That's the worst part.
It's in the design.
On slideshow.
Yeah.
I was being blamed for it. That's the worst part.
Transition.
Transition.
You need to cut off the transition.
Yeah.
Oh,
No,
straight on
it was on push.
All right.
That's just how it is.
Now it's compliant.
Let's see.
Who said that?
Julian, you see back there?
All right, let me do it from here, I guess.
No, we're gonna be outside. It'll be fine.
Over on the side it says duration. I don't know. It's not that high. Seems like.
No pressure, gotta go fast this time.
On mouse click.
There
If
we
you
go.
click that one.
Yeah, there you
There you
go.
go.
Who's the smart one back there? Erica.
I used to run PowerPoint for my church.
Okay, good.
Thank you so much. You could have said something before. All right.
All right, yeah, you're on.
Let's try again. Okay.
Okay, we're safe. Stop.
Yes.
Okay, we're going to be discussing home health risk that impacts the marketing, anti-inducement laws, CMS expectations. Who am I in the big picture? We're going to be doing some tests and then conclusion. Thank you. Next one. Okay. Compliance. No THH process and expectations. What are the goals for marketing? Ensure that all employees are stimulated, motivated, and guided to contribute fully to the realization of Total Home Health Inc. mission, vision, goals, and objectives. We heard it before. We have missions, we have objectives, we have goals that we need to attain. And they need to be written. Develop a market strategy that effectively markets the organization and educates the referral sources. That's important. In order for us to succeed, we need to ensure that that we know what we're selling, that we share our knowledge with the community. Responsible for the development and implementation of promotional strategy, special events, calendars that ensure the efforts, resources are utilized in a manner that provides the greatest return to the organization. Ensure that all events are planned to capture the attention of the intended audience. We need to ensure that we always know who we're targeting. We need to study and from the get-go, even before you go into a doctor's office, you need to know their specialty, you need to know the Medicare census that they have, You need to know about the hospitals that they visit. We're going to get into compliance and what are the hazards of marketing. Misinformation is provided. Thank God we have Ms. Sharon. She has been giving us so much information literature that we utilize so that we could be as educated as possible with regards to our marketing tools. Use them. When true and sustainable promises are made, we are home health care. We have to make sure that we understand the service that we're providing. We have to ensure that we stay within the scope of our practice. Inconsistent messages are given. Unethical or illegal inducements are offered. Competitors' orders are slandered, and legal consequences. We have to understand that we have to be as ethical as possible. We have to be clear and want a clear line on what we're doing. This is defined in the Medicare handbook. So we have to follow those guidelines. Medicare states that we can service our patients, we can provide skilled services, and that those patients need to qualify under their guidelines to ensure that they have a skill. Next slide, please. Home health risk areas that impact marketing. Referral issues, providing payment to entities or individuals to refer patients for services. We've seen it. We've seen a lot of home health agencies closing down, and that's because they're doing some of these practices that are being listed here. Providing free staff, rental payments for office space, meals and entertainment, training, or backup staff. Ms. Sharon was stating it before. We are being reimbursed by CMS. It's a federal government. We don't provide free stuff. And we have to abide by these regulations. We have to be clear as to when we go out with a physician, our objectives. One of the things that when I'm reviewing your invoices, I want to see that we have a sign-in sheet. I want to see that we have educational documentation as to what we discussed during the luncheon, because it's important. That's going to justify, that's going to make a difference of not falling in those parameters. Providing services for free or reduced rate to patients or potentially patients' family. That's one of the things that we are always monitoring. At times we do get calls from the hospitals, can you take this patient? We have to really ensure that the patient doesn't have insurance. Otherwise it could be interpreted that we're trying to buy the account, we're trying to pay up for the patient. We have to, if the patient has some type of insurance, we have to use those resources. We have to go back to that insurance and ensure that they are able to coordinate for the services. At times it's difficult because some of these insurances may not be from here. But unfortunately, we have to ensure that we understand these expectations. Payments to physicians to sign plan of care for home health care for certifications. I think that's something that we don't do here. And I'm 100% aware of that. CMS promotes training for new existing employees who work in the healthcare industry. We are responsible to ensure that we know the Medicare regulations, to know what we're doing and how we're selling, and the product that we're selling. And Medicare expects us to have a very good understanding of their regulations. So the training, we always need to be training. We always need to be prepared with the changes that are going on with Medicare. Medicare changes their regulations on a year-to-year basis, and they do updates on most of the things that we are able to service. Coverages. some products are covered this year, or they may not be coverable next year, so we have to keep up with it. So we're able to understand and educate our referral sources, not only in the services, but the products that we have. Anti-inducement laws, which is section 112A5, imposes civil monetary penalties against persons who offer or transfer remuneration to any individuals eligible for Medicare or state health care programs that such persons know or should know is likely to influence such individuals to order or to receive from a particular provider, practitioner, or supply in any item or services for which payment may be made in whole or for which payment may be made in part under Medicare state healthcare plan programs. This is what this is one of the regulations that Medicare has, one of their laws, that is the one that closes a lot of the home health agencies. And that's how they're monitoring this. Most of them fall into this category. Just to give you an overview, Total Home Health has written policies, procedures, and standards of conduct, a compliance officer, compliance committee, and high-level oversight. We do have effective training and education, effective lines of communication. We do have disciplinary standards, effective systems for routine monitoring and identification of compliance risks, procedures and systems for prompt response to compliance issues. This is what our corporate compliance plan consists of, and that's what Medicare expects us to follow. Who am I in the big picture? We are all responsible to ensure that we have the knowledge of the product that we're selling, and that the regulations and that abide us in our industry. As you can see, Medicare continues to hire more organizations and auditors. Right now, there are currently 15 of them. And the focus of these auditors is to ensure that there's no fraud being committed, is to ensure that the home health agencies are ethical. They do home visits to the patients. They do home site to the locations to ensure that the offices exist. It used to be years ago that agencies were being set up, and there were phantom agencies. And what happens is that they took so many of the Medicare dollars, and it cost them to ensure that they have all these different auditors in place so that it could prevent the fraud that has been going on with the Medicare funds. Know and abide by regulations set forth the state, federal, and accreditation. Stay true to THH Code of Ethics. Cooperate fully and truthfully to our ethics code. That's who I am. That's who I represent. Law test. Which of the following law prohibits knowingly submitting or causing someone else to submit a claim for payment with government funds using false information or making false statements in order to get a claim paid or approved by the government? Which one?
False claims act.
Thank you. True. The False Claim Act applies to that, and it is the one that they do a lot of persecution for any type of fraud that's been committed. Next one.
Just a minute. And any account executive that brings in business to the organization that was fraudulently gleaned In other words, you paid somebody to send us that patient. When we drop the bill, it's a false claim. Even though the agency didn't know. Because we procured that patient to the company illegally.
Correctly.
You've got the risk and the company's got the risk.
Could this be like if you signed out when the person's homebound when they're not homebound?
Not necessarily.
If what clinician signs off?
No. Has to do more with buying the patient.
Oh, okay.
But that's bad too.
Which of the following prohibits will for receiving or offering a bribe or rebate for referrals for services that are paid under the federal healthcare program? Start statutes, HIPAA, exclusion of. Oh, you're all smart. Very nice. You'll know. Next slide. Know that our company is committed to the policy that all employees have an obligation to report problems concerning involving ethical or compliance violations without fear of retaliation. That's part of the THH Code of Conduct. We have a process in place. You do have a supervisor that you report to. Report to your supervisor anything that you feel that is not ethical practice. We also have THH corporate compliance, which is 24/7, and that is there's a person that answers that phone and doesn't work for a company. It's actually a company that we hired, and that company will take your complaint and you don't even have to provide your information, and that will come to me. Employees, talk to your manager or supervisor. You can report it through the hotline, or you can call me. Same thing that we do, we also have it for our patients. We encourage our patients to either call us, should they have any complaints or issues, call you guys. They also have access to the total compliance line, and then they also have access to Medicare. But we want to ensure that they call us first and we try to resolve the problem. And that's what we need to educate them on, to give us at least the opportunity to resolve it, because we're ethical. Which of the following is also known as physician self-referral law? Good job. The STAR statute is also known as the physician self-referral law. A physician is prohibited from making a referral for healthcare services to any entity in which the physician or a relative may have an ownership or compensation interest. There are fines related to that, and we have to understand that definitely that's something that that will shut not only the physician's practice, but also will shut down the home health agency.
They do it every day.
Exactly.
So how is it that the hospitals get away with their home care agencies, like their own? You know, like a lot of hospitals have their own home health agencies.
Is the
They
hospital
do.
physician owned?
Exactly. It has to
Maybe not
be.
physician, but maybe it's like owned by the same,
Stark is
only
only
doctors.
physicians.
Okay.
Correctly.
Sharon, say that again, I'm sorry.
The Stark law applies only to physicians.
And the business that they may own.
So if they put their practice, then it's okay.
If they're not a practicing physician, but if it's a hospital-based agency, it's owned by a corporation. It's not owned by a doctor, so Stark does not apply.
So, but if the doctor stops practicing, but owns, let's
That's
say,
fine.
then it's okay. They're just
What
gonna be
They
practicing.
can't be self-referring.
Okay. No federal healthcare program payments may be made for any item or services furnished, ordered, or prescribed by any individuals or entity excluded by the Office of Inspector General, OIG. These exclusions are intended to protect beneficiaries from the risk of harm by untrustworthy individuals by barring them from participation in the fair healthcare program. Exclusions may apply to both. Yes.
If the OIG says you can no longer participate in CMS programs, it applies to both individuals, yeah. So,
Correctly.
and you can no longer do it for life.
Yeah.
Centers for Medicare and Medicaid Services.
You're excluded from the program, out.
If you get wrongful charges or
In-
breaking the law, not only do you have fines and things like that, possible jail time, but you can also never work for a federally funded program. You're blacklisted.
Correctly. One of the things that this company does is every employee that comes on board, we do an OIG verification. And for every contracted company that we have on board, we do an OIG verification on the company, on the owners, and whoever is the managing employee.
To make sure they're not on the exclusion list.
Correctly. Next test. You're all passing. Nice. I like that. I believe so. The Health Insurance Portability and Accountability Act, HIPAA, mandates that organizations implement safeguards to prevent unauthorized access to protected health insurance information, requires organizations to notify individuals if there is a breach of their protected health information, provide individuals with the right to limit access to their protected health information. Which, John, that's right. HIPAA does all of these. While it is a crime to knowingly obtain or disclose protected health information for fraudulent purposes, it is HIPAA violation to disclose protected health information to an unintended recipient, even when there is no criminal intent. So we have to be very careful out there, especially when we are reviewing the patient's charts. Who are we sending this information to? Who are we sharing this information with?
What about when ADs are running around with doctor's orders?
That's a no.
They've got to be careful, right?
They have to.
They're not flying down the street.
Correctly.
And then if they stop their car, they have to be turned over to where nobody, because people will walk through parking lots, especially in facilities that are from their agencies, and look in cars for healthcare to see if information is laying out
And if
in
you
the
bring them
seat.
home, don't throw it in the trash.
Right.
You have to shred them.
Yeah.
That's why you don't valet park your car, correct? If you have
Yeah.
charts and stuff or patient orders and stuff, you don't valet park your car because
You never know.
you never know.
Someone else has access.
Absolutely. Maybe.
I mean, there's a story of a rep just this past week here in Broward County that she accidentally left patient's information in the noise room. And it was turned into security, and security turned it into case management, and she lost her job.
Well, she also.
That's unfortunate, but it happens.
Hey,
I
Joe.
mean, you just have to-
Good rep. Just asking. She probably learned her lesson.
I'm sorry?
Cell phones. Your cell phone should have a passcode.
Yeah.
Because if you guys are sometimes texting the office saying, can you do this referral and such, that's another thing too.
Yeah.
You should have a passcode.
Thank you so much for sharing that information. Great.
Say it out loud that all cell phones need to be password protected, do that.
Exactly. Not only the cell phones, they need to be password protected, but also your iPads.
I have a question for you.
Yes, ma'am.
Okay, so say for instance, you go to, like an assisted living and the patient wants services, but they don't have a doctor. So you're gonna transmit that information to a doctor who go on to the patient. Do you have to get consent from the patient to release that information over to the doctor? Who not see the patient yet?
Good question. We should. As a,
Yeah, restate the question.
You get
What she was stating was that if a patient, you go and visit a patient who doesn't have a physician, and the patient, you want to refer the patient to a physician, what type of documentation should you have in place in order to ensure that you're not violating the HIPAA laws?
What we're doing is giving it to hospitals to do it often, and all you're doing is the patient wants the doctor home, so all you're doing is telling the doctor the address of the patient's name. We're not really giving, my office doesn't give patient information to the doctor gets that, so that's the way we do it.
Well, the history and physical, no?
We do share information at times with the physician with regards to the patient's health information, and we also do it with, we also at times provide them their demographics. Now usually, to answer your question, some of these patients are already on board with us, and once they are admitted under our care, then definitely we can share that information with them without any problem. Now we do have, now the patient has never had services and they want you to provide that information to the physician, we should get something, some type of authorization from them. That would be the best practice. We have a consent form. Yes.
It's just different.
That's it. But, you know. It's more exciting. Non-complying with your company's obligation. Protect all health, financial, and/or employment information. Limit access, use, and sharing of information to the minimum amount necessary to achieve the task. Avoid using social security numbers when sending information out to externally unless there is a compelling business need. That's really important. We need to ensure that we have, that whatever information we share is only the necessary information that they're going to need to in order to process the assignment. Again, we do have DHH corporate compliance. And that's it for my presentation. Thank you so much. That was more than 15 minutes, I know that.
I didn't even time you. It was so good, we were just engaged. Time didn't matter. You heard me say earlier this morning, when right before giving Stephen his award, how regardless of the fact that he was a student of the game and by many standards on top of his game at 42 admissions a month as an average for many years, Stephen still wanted to grow his book of